Hello learners! Did you know about the thoracic duct? So keep an eye out, and learn about. The thoracic duct is the largest lymphatic vessel which drains lymph from most of the body into the bloodstream. The duct appears beaded due to the presence of numerous valves in its lumen. In this video we shall look at the anatomy of the thoracic duct, its area of drainage, extent, relations, tributaries, and development. Extent of thoracic duct. The thoracic duct extends from the upper end of cisternacally, on the posterior abdominal wall, at the lower border of T12 vertebra, to the junction of left internal jugular, and left subclavian veins at the root of the neck. Course of the thoracic duct. The duct begins in the abdomen at the lower border of T12 vertebra, as a continuation of cisternacally, and enters the thorax through the aortic opening of the diaphragm. It then ascends in the posterior mediastinum to right of the midline on the front of vertebral bodies. On reaching the T5 vertebra, it crosses the midline from right to left side, and enters in superior mediastinum to run along the left border of the esophagus, and reaches the root of the neck. At the root of neck it arches laterally at the level of C7 vertebra, and finally terminates by opening into the junction of left subclavian and left internal jugular vein. Relations. The relations of thoracic duct are as follows. A. At the aortic opening of the diaphragm. Anteriorly related to median arcuate ligament of diaphragm. Posteriorly related to T12 vertebrae. Right side related to azygous vein. Left side related to aorta. B. In the posterior mediastinum. Anteriorly related to diaphragm, esophagus, descending aorta. Posteriorly related to vertebral column, posterior intercostal arteries, hemizygous veins, anterior longitudinal ligament. Right side related to azygous vein. Left side related to descending thoracic aorta. C. In the superior mediastinum. Anteriorly related to arch of aorta, left subclavian artery. Posteriorly related to vertebral column. Right side related to esophagus. Left side related to left lung and pleura. D. In the neck. The thoracic duct forms an arch above the clavicle. The arch has the following relations. Anteriorly related to left common carotid, left vagus, left internal jugular. Posteriorly related to vertebral artery and vein, sympathetic trunk, thyrocervical trunk, left phrenic nerve, prevertebral fascia, and left subclavian artery. Tributaries of thoracic duct. The thoracic duct receives lymph from both halves of the body below the diaphragm, and left half above the diaphragm. The tributaries of the thoracic duct are as follows. A. In the abdomen. The thoracic duct receives lymph vessels from lower 6 intercostal lymph nodes of both sides. B. In the thorax. 1. A pair of the ascending lymph trunks which drains lymph from the upper lumbar lymph node. 2. A pair of the descending lymph trunks which drain lymph from the posterior intercostal lymph nodes of upper 6 spaces. 3. Lymph vessels from the posterior mediastinal lymph nodes. C. In the neck. 1. Left jugular lymph trunk, draining lymph from the neck. 2. Left subclavian lymph trunk, draining lymph from the left upper limb. 3. Left bronchomediastinal trunk. Development of thoracic duct. There are 3 stages in the development of the thoracic duct. Stage 1. In this stage, network of lymph channels is seen in front of the thoracic part of the vertebral column. Stage 2. In this stage, 2 longitudinal lymph channels appear in the network of lymph channels, one on the left and another on the right with a number of cross communications. Stage 3. In this stage, The cross-communication appears opposite the T5 vertebra, right longitudinal channel below this cross-communication, and left longitudinal channel above this cross-communication persists, and form the thoracic duct. All the other parts disappear. Thanks for watching. Don't forget to subscribe, like, share, and comment down.